Right now, somewhere in this country, a man is going to swing his legs out of bed, twist his spine just slightly to reach for his glasses on the nightstand, and feel something pull deep in his lower back that will not fully let go for the next 6 weeks. He did not lift anything heavy. He did not fall. He did not do anything that looked even a little bit dangerous. He simply got out of bed the way he has gotten out of bed every single morning for the last 40 years. And that is exactly the problem. Because the way most of us get out of bed, the twist, the stretch, the reach, the toe touch that is supposed to loosen us up, is happening during the one narrow window each day when your spine is at its most fragile. Not after a long day of standing. Not after yard work. Right when you wake up, before you have even had a sip of coffee. And by the time we are finished today, you will never get out of bed the same way again. Before I show you exactly what is happening while you sleep, I want to ask you for something small. If you are over 50 and you are serious about protecting your body instead of just reacting when something goes wrong, hit that subscribe button right now. I am building a community here of people who want to catch problems early, not after a trip to the emergency room. Every person who subscribes tells me this channel is worth continuing to make, and it helps me decide exactly which topics matter most to people your age. It costs you nothing, and it means a great deal to this channel. I have watched this exact injury happen to patient after patient in my clinic, always followed by the same confused question. They tell me they did not do anything, they just got out of bed. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with patients just like you, men and women over 50 who are trying to protect their health before something goes seriously wrong. What I am about to walk you through today is not a stretch, it is not a supplement, and it is not something you buy. It takes less time than brushing your teeth, and it addresses a mechanical weakness in your spine that almost nobody explains correctly, including plenty of well-meaning fitness influencers half your age. I want to know something before we go further. Does your back feel the worst the moment your feet hit the floor in the morning, or does it actually loosen up once you have been moving around for an hour or two? Type morning if the first few minutes are the hardest part of your day. Type later if it is the opposite and your back gets worse as the day goes on. I read every single comment, and the pattern in your answers is going to shape what I make next. Here is something almost nobody tells you about your own spine. While you are asleep, something is happening between each of the bones in your lower back that has nothing to do with dreaming and everything to do with why mornings hurt. Between every 2 vertebrae sits a small cushion called a disc, and that disc behaves less like a solid rubber washer and more like a sponge. All day long, gravity and the simple act of standing and sitting squeeze fluid out of that sponge. Then at night, lying flat takes the pressure off, and the disc pulls fluid back in, the way a sponge left in a shallow puddle slowly swells overnight. By morning, those discs are noticeably plumper and more pressurized than they were the evening before. Physicians sometimes call this intradiscal pressure, which simply means the pressure inside the disc itself. And here is the part that matters to you. A more swollen, more pressurized disc is a stiffer disc, and a stiffer disc under a sudden bend or twist does not flex the way it will later in the day. It resists, and then it can tear. This is not a rare edge case. It is simply physics acting on tissue. The same way an overfilled water balloon is more prone to bursting at a weak seam than one that is only half full. Your discs are not fragile in general. They are only unusually vulnerable during this one specific overnight to morning transition. And once you understand that window, you can work around it instead of being surprised by it again and again. I am going to come back to exactly what that means for the way you get out of bed in a moment, but first I want you to actually feel this for yourself. I want you to do something right now, wherever you are watching this. Sit up a little straighter and place 2 fingers right at the small of your back, just above your belt line, on either side of your spine. Press in gently. That firmness you feel is not only muscle, it is also the current state of those discs we just talked about. Now think back to this morning. Did you swing both legs out of bed at once and sit straight up in one motion? Did you twist to silence an alarm or reach for your phone before your feet even touched the ground? If you did, and most of us did, you performed a combined bending and twisting motion on your spine during the exact window when those discs were at their most swollen and least forgiving. That is not carelessness. Nobody ever taught you otherwise. In a moment, I am going to show you the specific way to move instead, but I need you to understand one more thing first, because it explains why the advice you have probably been given your whole life is backwards. You are very likely a measurably different height right now than you will be tonight. Most adults are close to half an inch taller first thing in the morning than they are by bedtime, and nearly all of that difference comes from the spine. It is well documented in orthopedic and physical therapy literature that the discs throughout your spine swell overnight and gradually compress throughout the day. This is not unique to people with back problems. It happens to every person with a spine, every single night of their life. The difference is what you do with that information. For someone who understands it, the first 30 minutes after waking becomes a window worth protecting. For someone who does not, it becomes one of the most common times of day for a specific kind of back injury to occur. Think about a kitchen sponge that has dried out sitting on the counter. Press down hard on it while it is dry, and it barely gives, it just sits there stiff. Now soak that same sponge for 8 hours and press on it again. It gives instantly, it compresses, it can even tear at the edge if you twist it hard enough while it is fully saturated. Your spinal discs are not exactly sponges, but the fluid behavior is remarkably similar. Slightly deflated after a full day of standing and moving, they handle bending reasonably well. Fully saturated after a night of lying flat, they are plumper under more internal pressure and less able to absorb a sudden twisting or bending load without the outer wall of the disc, called the annulus fibrosus, taking on stress it was not built to handle in that moment. I want you to hear that term because you are going to hear it again. The annulus fibrosus is simply the tough outer ring of the disc. Think of it as the rind around a softer center. Low back pain affects roughly 80% of adults at some point in their life, and it becomes noticeably more common with age, in large part because disc tissue slowly loses some of its water-holding capacity and elasticity over the decades. That does not mean the situation is hopeless, it actually means the opposite. Because so much of the day-to-day risk comes down to mechanics, meaning how you move rather than some unfixable structural doom. The movements you choose in that first vulnerable half hour of the day genuinely matter. Physical therapists who specialize in spine rehabilitation have taught variations of a protective morning routine to patients recovering from disc injuries and surgeries for decades, precisely because they have seen how much repeated forward bending first thing in the morning slows healing and even causes new injuries in people who were otherwise doing everything right. Here is a belief almost everyone over 50 has been told at some point, usually with good intentions. Loosen up your back first thing in the morning by bending forward and touching your toes a few times before you even get out of bed. It sounds reasonable. Stretching feels productive. But based on everything we just walked through, that advice has the timing exactly backwards. Forward bending, especially combined with any twisting, places direct pressure on the front of those swollen discs and pushes stress toward the back wall of the annulus fibrosus, the exact structure most commonly involved in disc bulges and herniations. Doing that specific movement during the 30 minutes when your discs are at their most pressurized is not neutral, and for a meaningful number of people, it is the single riskiest movement of their entire day. Done first thing, before they have even had coffee. The same stretch performed 2 or 3 hours later, once your discs have naturally lost some of that overnight fluid, is dramatically safer for your spine. Timing is not a small detail here. Timing is the entire difference between a helpful stretch and a genuinely risky one. I want to be clear about something. I am not telling you stretching is bad or that movement is dangerous. Movement is one of the best things you can do for a long-term healthy spine. I am telling you that timing and technique matter just as much as whether you move at all. And nobody ever sat most of us down and explained that the first half hour of the day deserves a completely different approach than the rest of it. Researchers who study spinal loading have documented for decades that the pressure inside your lumbar discs changes dramatically depending on your position. Lying flat produces the least pressure of any common position. Standing upright produces meaningfully more. And slouched sitting, the kind most of us default to on a couch or in a car seat, can actually produce more disc pressure than standing does. This is exactly why the transition from lying flat all night to standing upright is not a small, meaningless shift for your spine. It is one of the largest pressure changes your discs experience in any 24-hour period, layered directly on top of the overnight swelling we already talked about. Two significant changes stacking on top of each other in the span of about 60 seconds is exactly the kind of moment where an old injury flares or a new one begins. Here is a number that surprises most people. Studies on spinal loading suggest that a large portion of that overnight fluid gain, sometimes more than half of it, is lost again within the very first 30 to 60 minutes of standing and moving around. That means the truly high-risk window is not the whole day, it is a short, specific stretch right at the start of it. Which is actually good news, because it tells you exactly where to focus your attention instead of feeling like you have to walk on eggshells every waking hour. Protect that first half hour with a few smart choices, and by the time you are showered and having breakfast, your spine has already returned much closer to its normal, resilient daytime state. This is not about permanent restriction. It is about respecting one short, predictable window your body goes through every single day, whether you pay attention to it or not. There is one supporting habit worth mentioning here, not as a quick fix, but as a long-term ally. Discs do not have their own direct blood supply the way most tissues do. They rely heavily on fluid exchange to stay nourished, which means overall hydration throughout your day plays a meaningful role in long-term disc health, not just what happens overnight. This does not mean drinking water the moment you wake up will erase decades of wear. That kind of promise would be dishonest. What it does mean is that steady hydration across the entire day, combined with regular movement, gives your discs the best possible environment to stay resilient over the years. Think of today's morning technique as protecting the disc you already have, and steady hydration and movement as slowly helping to maintain its overall health for the years still ahead of you. It sometimes helps to picture each disc like a jelly-filled pastry. There is a softer, gel-like center, which doctors call the nucleus pulposus, and a tougher layered casing around it, which is that annulus fibrosus we already talked about. When the gel center absorbs extra fluid overnight and swells, it pushes outward against that casing with more force than usual. A healthy casing handles this fine under normal, controlled movement. But add a sudden combined bend and twist, the kind most of us perform without thinking as we sit up and reach for a phone, and you are asking that swollen, pressurized casing to withstand a shearing-type force at the exact moment it has the least flexibility to absorb it. That is not a guess. That is simply how layered fibrous tissue under internal pressure behaves under load. I see this pattern constantly in my practice. So often that I can usually guess how the injury happened before the patient even finishes describing it. Someone comes in holding their lower back, moving carefully, sometimes barely able to stand up straight in my exam room. I ask what happened, and the answer is almost always disappointing to them. They did not fall. They did not lift a heavy piece of furniture. Most of the time they tell me, almost apologetically, that they just got out of bed a little too fast, or twisted to grab the alarm clock, or bent down to pick up a slipper less than a minute after waking up. Sometimes it happens reaching to shut off a blaring alarm, twisting hard toward the nightstand in that groggy, half-awake state before the brain is even fully in charge of the body. Sometimes it happens reaching down for a robe crumpled on the floor, bending forward in one quick motion because standing there half-dressed feels urgent, even though nothing about it actually is. None of these moments look dramatic from the outside. There is no crash, no loud snap, sometimes not even much pain in that very first second. The real damage often reveals itself an hour later, or even the next morning, when the person tries to stand up again and suddenly cannot move the way they could the day before. They feel almost embarrassed, like the story is too small to justify how much pain they are in. I always tell them the same thing. The story is not too small. The timing explains everything. Once they understand that, something shifts. It stops feeling like their body randomly betrayed them for no reason, and it starts feeling like there was a hidden rule they were never taught, a rule that, once they know it, they can actually work with instead of against. I also want to say clearly that this is not about blame, not toward the patient, and not toward whatever doctor may have rushed through their last checkup without mentioning any of this. Most people were simply never given the chance to learn it. Today, right now, you are. Here is something worth sitting with for a moment. There is no billing code for teaching a patient how to safely get out of bed. A 5-minute conversation about morning mechanics does not generate a follow-up appointment, an imaging order, or a prescription. It is not that any single doctor is doing something wrong. Most of us are simply working inside a system built to respond after damage has already happened, rather than one designed to prevent it from happening in the first place. That is exactly why information like this so often lives in a video instead of a 15-minute office visit. It is not glamorous, it does not require a procedure, and it does not fit neatly into how the system gets paid. It just happens to work. I want you to think about someone in your life right now, a parent, a spouse, an older sibling, a friend from church or from your neighborhood, someone who has quietly complained about their back hurting worse in the mornings for years without ever quite knowing why. You now know something they do not. You know that it is not just age catching up with them, and it is not something they simply have to live with. Send them this video right now before you forget, because this single piece of information could change how they move through the first 30 minutes of every single day for the rest of their life. And if this video is teaching you something your own doctor never had time to explain, please subscribe to this channel. I am trying to build a place where practical, honest, mechanism-based health information is free and easy to find for people over 50, instead of buried behind jargon or rushed through in a 10-minute appointment. I also want to ask you something I ask in almost every video, and there is a real reason behind it, not just curiosity. Tell me your age in the comments below. The recommendations that make sense for a 52-year-old with a healthy spine are not identical to the recommendations for a 78-year-old managing an existing disc condition. And knowing who is actually watching helps me tailor exactly what I teach next and how carefully I need to explain each step. It also helps me decide which topics to prioritize, because I would rather spend my time on what matters most to the people actually here watching this. Let me ask you something a little uncomfortable. If a single 20-second change in how you move out of bed could meaningfully lower your risk of a disc injury, why has almost nobody ever shown you exactly how to do it? Not a vague suggestion to move carefully, not a warning to be gentle with yourself, the actual physical technique, step by step. I think the honest answer is that it is simply not dramatic enough to teach. It does not involve a machine, a supplement, or a procedure. It is just movement, done in the right order, at the right moment. And movement done correctly, at no cost, is one of the most underrated tools in all of medicine. I told you earlier, I would show you exactly how to move instead of the twist and reach most of us default to, and I am about to keep that promise. But there is one more small piece I have been holding back, because it changes how much this technique actually helps you. It is not only about how you get out of bed, it is about what you do in the 10 seconds before you even attempt to sit up. Most people skip that part entirely, and skipping it is the reason some people try a safer getting up technique once, do not notice much difference, and quietly give up on it. I am going to walk you through both pieces together in a moment, the preparation and the movement itself, because used separately, they barely help, and used together, they are remarkably effective. First, though, I want you to understand why so many people quit on a solution this simple before it ever has a real chance to work. Before I give you the full technique, I want to hear from you one more time. Has your back ever gone out on you first thing in the morning, seemingly out of nowhere, the way I described earlier? Tell me your story in the comments. I read every single one, and it genuinely helps other people watching feel less alone in this. And while you are there, tell me what you want me to cover next. Sleep positions that protect your spine, safe ways to pick things up off the floor, or exercises that strengthen the muscles supporting your lower back. Whatever comes up most, that becomes the next video. Here's the moment I want to warn you about honestly, because I would rather you know it in advance than get discouraged by it. If you actually do this technique every morning, somewhere between 1 and 2 weeks in, your back is likely going to feel noticeably better. And the moment it feels better is exactly the moment most people quietly stop doing it. It makes sense psychologically. The pain was the reminder, and once the pain fades, the reminder fades with it. And slowly, the habit slips away without anyone deciding to abandon it on purpose. I want you to see that moment differently. The morning your back feels almost normal is not the finish line. It is the actual proof that the technique is working, and it is the single most important moment to keep going rather than stop. Think of it less like taking medicine until symptoms disappear and more like brushing your teeth, something you keep doing specifically so the problem never returns in the first place. The goal was never to fix one bad morning. The goal is to permanently change the riskiest 30 seconds of your entire day, every single day, for the rest of your life. Here is exactly what to do, starting tomorrow morning before your feet ever touch the floor. None of this requires special equipment or extra time. Most people can complete the entire sequence in well under a minute once it becomes familiar. The first step happens before you move at all. While you are still lying on your back, gently rock your knees side to side a few inches, keeping them bent and your feet flat on the mattress, for about 10 slow repetitions. This is not a stretch, it is simply waking up the fluid movement in your spine gradually instead of shocking it awake all at once. The second step is switching on that natural weightlifting belt we talked about earlier. Take one slow breath and gently draw your belly button in toward your spine, holding that light brace for the rest of these steps. It should feel like about 20% effort, not a hard squeeze. You will notice this brace almost immediately if you rest your fingertips gently on your lower abdomen while you do it, feeling a slight firming rather than a hard clench. The third step is the roll. While keeping that gentle brace, roll onto your side, bringing your knees up toward your chest as you turn. Do not sit straight up from your back under any circumstances because that motion combines bending and twisting in exactly the way that stresses a swollen disc the most. The fourth step is the push. From your side, use your top arm to press your upper body up, letting your legs swing off the edge of the bed at the same time as a counterweight. You should end up sitting on the edge of the bed using almost no spinal bending at all. Your arm and your legs did the work instead of your lower back. The fifth step is patience before you stand. Sit on the edge of the bed for a slow count of 5 before pushing up to standing, giving your body one more moment to adjust to being upright after 8 hours flat. The sixth step is about the first 10 minutes after that. Avoid touching your toes, avoid bending forward to pick up slippers or clothing off the floor, and avoid any twisting reach for at least 15 to 20 minutes. If you need to put on socks or shoes, sit in a chair and bring your foot up to you instead of bending down to your foot. This single adjustment, protecting your spine from unnecessary forward bending in that narrow window, is often the difference between a normal, uneventful morning and the kind of morning that turns into 6 weeks of limping around the house. The seventh and final step is simply consistency. Do this every single morning, including the mornings your back feels completely fine, because the discs swell overnight whether you are currently in pain or not. This is not a treatment for a flare-up. It is a permanent change to the riskiest 30 seconds of your day. None of these 7 steps require any equipment, any supplement, or any special flexibility. If you have a diagnosed disc condition, a recent spine surgery, or pain that is severe, sharp, or radiating down your leg, please talk to your doctor before starting any new movement routine, including this one, so it can be tailored safely to your specific situation. Print these 7 steps out if it helps. Tape them to your nightstand for the first 2 weeks until the sequence becomes as automatic as reaching for your toothbrush. Thank you for spending this time with me today, and more importantly, thank you for caring enough about your own body to want to understand it instead of just reacting to it when something hurts. If this video changed the way you are going to get out of bed tomorrow morning, that alone makes it worth making. Please consider subscribing and joining this community of people who are choosing to stay ahead of their health instead of falling behind it. Every person who joins helps me keep making videos exactly like this one, free, honest, and built around how the body actually works. One last thing, because your safety matters more to me than any video ever could. Everything I shared with you today is general education based on how the spine typically works, not a diagnosis or a personal treatment plan for you specifically. If you are currently dealing with back pain that is severe, sudden, or connected to numbness, weakness, or loss of bladder or bowel control, please see a doctor promptly rather than relying on a video alone. For everyone else, use what you learned today as a starting point for a conversation with your own physician, someone who knows your history and can guide you safely. Take care of that spine of yours. It is the only one you get.